2013, Sister Jacqueline Leakey took up what would become the anchor leg of this phenomenal journey. Sister Jacqueline Leakey is our perhaps not so secret weapon. She not only heads the Mandeville Regional Hospital Bfhi Coordinating Committee, but she has unilaterally trained hundreds of members of staff. Under her leadership, there were many high points. We participated in 2014 in the National Breastfeeding Debating Competition. In 2015, we were feeding expo activities. And these were great accomplishments. But through it all, we kept our eye on the great prize. My friends, achieving baby-friendly hospital status requires the discipline of an army, the harmony of an orchestra, the precision of a 4x100 relay team, and the fortitude of a number 9 batsman batting to save the match. And yes, we did it. But I'll tell you no lie, it was difficult. Achieving baby-friendly hospital status is hard, especially for large institutions. You see, size matters. As has been alluded, we are required to train our entire staff complement. And at Mandeville Regional Hospital, we have a staff complement of 800 persons. And we had to train at a minimum 80%. And I mean nurses, I mean midwives, I mean cleaning staff, I mean security staff, I mean administration staff, I mean doctors who already think they know everything about everything. We had to train them all. We have estimated that over the 16 years that we have been on this journey, we have trained in 1,000 members of staff simply to reach this goal. So yes, it's difficult, but I have good news. It's not impossible. We did it. We did it, and we're going to share with you a few of the things that we think made all the difference so that your journey can be easier. Cooperation is key. Cooperation is key. Cooperation is key. The cooperation between all facets of the Mandeville Regional Hospital Bfhi team was exceptional. Ladies and gentlemen, let me introduce this team to you. At the center, keeping us all together, was our Bfhi coordinator, Sister Jacqueline Leakey. Give her a hand, she deserves it. Also on the team, the Mandeville Regional Hospital Administration, led from the front, our CEO, our Senior Medical Officer, or Ops Manager. They were at the start of the charge. They were with us, leading us all the way. Or nursing, or Department of Nursing, again, led from the top, or Director of Nursing Services, or Matron. All our nurse managers, every single one, or nurses on the antenatal ward, on the postnatal ward, on the pediatric wards, in the postnatal clinic, and on the antenatal clinic. Every single one. Our community partners. The Bfhi experience does not start or finish when you enter hospital. It starts before you arrive and it continues after you have left. So the hospital cannot do it alone. We were ably, I don't even want to say assisted. We walked hand in hand with our community partners, the Manchester Health Department, our community midwives, and our community health aides. We thank you so much for your partnership in this effort. The Department of Nutrition, our regional nutritionist, Miss Alice Carney, who I remember begged me to come on board with this initiative. Our beautiful head of department, Miss Marie Powell, and How are the ladies? I did not even realize that she had such a huge department. I think it's 45 persons in her department. It's a large department. The doctors. Doctors can be troublesome. In obstetrics, I thank you so much, each and every one of you, for joining us on this journey. Clearly, we could not have done it without you. The Southern Region Hospital, Southern Region Health Authority board, from the entire board, they were with us 100%. There was nothing we asked for that they said, no, that's too much. That is beyond what we are capable of. Everything we asked for, they said, let's see how we can make that happen. The MIS department, who I firmly believe are the best in the island of Jamaica. And every single head of department in this hospital. I mean orthopedics, I mean ear, nose, and throat, I mean all of them. Ladies and gentlemen, the team, the dream team. So this is a big team. This is a big team. This is a diverse team. This is a team with differing training, differing priorities, differing needs. How do you unify such a diverse team? Well, you need a good cause. And baby-friendly hospital accreditation is a good cause. So, we are all familiar with the 10 steps to successful breastfeeding. These 10 steps coalesce around 2 key points. And this team agreed with those 2 points. And those 2 points were the cords that bound this diverse team. First of all, we agree that breastfeeding advocacy is perhaps the single intervention with the greatest potential to improve the health of our nation. That's a bold statement. You may say, are you sure? Well, this is what we believe. You see, breastfeeding has the potential to positively impact 4 generations. It impacts the newborn at the time of birth, and the benefits that are gained resonate through that child's life, through infancy, through adolescence, and even into adulthood when that child will begin her new family. Breastfeeding advocacy helps a mother at the time of childbirth, but the benefits of breastfeeding continue to be felt even when that mother who breastfed is a grandmother. She is still reaping benefits from the breastfeeding advocacy. And so we believe that breastfeeding is perhaps the single greatest bang that you can get for your healthcare buck. We believe in client-centered care. The Bfhi initiative, the Bfhi ethos is all about client-centered care. It is about seeing that newborn as your client. That newborn, every newborn, a citizen of Jamaica entitled to excellent care. That mother, a citizen of Jamaica entitled to excellent care. And it is these 2 ideas that translated across specialties, across ideas, across priorities. We believe that a baby-friendly hospital is a better hospital, and a baby-friendly healthcare system is a better healthcare system, and a baby-friendly Jamaica is a better Jamaica. So in case you missed it, the first point, without unity of purpose, achieving and keeping baby-friendly hospital status is impossible. The next point. So we had our worthy cause and we were unified, but we still had some technical issues. Remember, we alluded to the issue of being a large institution. institution. And although we had a very focused and committed and unified team, we still had to translate this into action. And remember, I spoke about this issue of trying to train this team that was so huge. And it felt, and I have experienced this many times, it felt as if as soon as you trained a cadre of doctors or nurses, they migrated, moved on, went to another place, and you came back onto the ward, and your 75% training had gone down to 55%, and you had to start over. We realized that we needed a new tool, that the old way of doing things really just was not going to get us across the finishing line. A new approach was needed. So this brings me to key point number 2. If you can't find the right tool, build it. And so, with no training, with no previous experience in so doing, the baby-friendly hospital trainers set about adapting the didactic face-to-face curriculum into an online platform. We were assisted hand in glove by the MIS Department of the Southern Region Health Authority. And in so doing, we were able to create a tool that was portable, flexible, and adaptable. It could be accessed from any laptop or smartphone at any time at the pace of the student. And this made all the difference. So in 2018, we launched the Southern Region Health Authority Bfhi e-learning platform. Later that year, we celebrated the graduation of our first cohort of students. I will be forever grateful for this cohort of students. They went through 20 online hours of education by themselves without knowing if there was going to be anything at the end, because remember, we had not received any external validation or certification. This was simply our effort. And these students went through the portal, so we were able to identify any issues and improve upon them. I am forever grateful to this group of pioneers. Since then,